Pediatric DUCT Score, a highly specific predictive model for choledocholithiasis in children. Published by Dr. Romeo Ignacio in the Western Pediatric Surgery Research Consortium, presented by Dr. Gretchen Floan. Choledocholithiasis has been reported in as high as 30% of children who undergo cholecystectomy for choledocholithiasis. The American Society for Gastrointestinal Endoscopy has proposed guidelines to help with the diagnosis and management in adults. However, the use of such criteria is uncertain for the pediatric population. We sought to investigate pediatric-specific predictive factors for choledocholithiasis and create a validated pediatric risk model. We hypothesized that an algorithm based exclusively on pediatric data will more accurately predict choledocholithiasis in children and provide more reliable guidance for management. We performed a multi-center retrospective cohort study over a 4-year period that included pediatric patients who underwent cholecystectomy for gallstone disease. Data collection was performed by the Western Pediatric Surgery Research Consortium, which is a collaborative group of 10 pediatric surgery centers across 7 western U.S. states. Categorical and continuous variables were evaluated with standard statistical methods. Univariate and multivariable regression analysis were performed in the demographic, clinical, and ultrasound data with ROC curves to determine predictive factors and cutoff values. In order to create our model, 80% of our total cohort was used for model development, and 20% of our cohort was held aside at random and reserved for model testing and validation. The cohort comprised of almost 1,000 patients with an average age of 14, 75% were female, 59% were Hispanic, and a third of the patients were considered obese. We identified 3 predictive factors for choledocholithiasis, coined as the Pediatric DUCT Score, based on a dilated common bile duct of greater than or equal to 6 mm, ultrasound with visualized common bile duct stone, and a total bilirubin of greater than or equal to 1.8 mg per deciliter. A predictive capacity was then calculated, and a stratified risk score was developed based on the presence or absence of these predictive factors, as seen on the right. For the risk categorization, you can see that the positive predictive value increases as a patient becomes more high risk for choledocholithiasis. The negative predictive value also increases to its highest value of 89% for the high-risk group. This table represents a comparison of our predictive capacities with other adult and pediatric studies. Ours represents the largest study to date and has superior accuracy, sensitivity, and negative predictive value, with comparably high specificity and positive predictive value. In conclusion, we were able to create the Pediatric DUCT Score and develop a risk stratification model with a high predictive capacity for choledocholithiasis in children. We found that several adult risk factors for choledocholithiasis are not reliable in children, but the Pediatric DUCT Score is reliable and superior to other data available. This study can improve the diagnosis and management of choledocholithiasis and potentially decrease unnecessary imaging studies and interventions for children. Thank you.